My name is Meghan Flanagan, and I am an assistant professor in the Department of Surgery at the University of Washington and Seattle Cancer Care Alliance, and an affiliate investigator in the Public Health Sciences Division at the Fred Hutchinson Cancer Research Center. The title of my talk is The Association of the HSD3B1 gene in breast cancer recurrence among women who have estrogen receptor-positive breast cancers. In 2020 alone, there's estimated to be almost 300,000 new cases of breast cancer among women in the United States, and the vast majority of these patients have estrogen-sensitive breast cancers. One of the main cornerstones of treatment for these women is a class of drugs called aromatase inhibitors, and these drugs are aimed at decreasing the amount of estrogen in a woman's body so that it can't go to feed or fuel the cancer cells. Unfortunately, we don't have any biomarkers or good ways to really estimate which women will respond well or not as well to this medication. So our study is actually aimed at testing all women in the study for a genetic mutation called HSD3B1, which has to do with the way that all of our bodies metabolize estrogen. And we hypothesize that among women who carry this mutation, either in all the cells of their body or in just their cancer cells, that they may not actually respond as well to these aromatase inhibitors or these estrogen blocking drugs. So we think that among women who don't have this mutation, they actually may respond better than average, whereas women who do have this mutation may not respond as well to this class of medications. This study aims to identify these women so that we can better aim our therapies or have better precision with our therapies for this large class of women who have these types of estrogen-sensitive breast cancers. The Swim Across America grant is so important for this research, given that it's really looking at generating pilot data. The idea for this study actually comes as this gene has been studied in men with prostate cancer. Prostate cancers are also hormonally driven cancers that parallel breast, and this gene has been shown to be associated with fairly poor prognosis among men who have this gene mutation and develop prostate cancer. We hypothesize that women who have this may also have a similar prognosis, and currently there are no groups that are studying this specific gene mutation among women with breast cancer that we're aware of. And so generating this pilot data will really allow us to help identify women who may respond better or worse to the aromatase inhibitor drugs. And it may open up the possibility of the development for novel therapeutic options for women with this mutation in the future. I would love to just thank all the swimmers, corporate sponsors, and Swim Across America for supporting these pilot grants, which are so important to get initial data to then be able to move on to larger prospective studies. And we really wouldn't be able to do this work without these seed or pilot funds. And so we really appreciate your support, and specifically for women who may have this mutation, this could be a huge effect in changing actually how we treat these women.